today I want to talk to you about daily self-care. We know that there is a deep connection between how we're feeling physically and how we're feeling mentally. If we aren't feeling well emotionally or mentally, then sometimes our daily self-care routines can start to get compromised. And when that happens, it can certainly circle back very easily and compromise our mental health. And we end up feeling worse, and it kind of just perpetuates their going back and forth. So what we know helps for mental health, for good emotional regulation, is that we have regular places for restorative sleep, clean eating, regular leisure, and regular exercise. I also want to make a special note here about how these daily self-care routines have been compromised in the last year since the COVID-19 outbreak. And I want to encourage people to rethink and have a chance to redo their winter or spring routines based on what we couldn't achieve for ourselves last year. The COVID-19 outbreak tended to catch most of us off guard, and in that state of losing control and losing our regular social connections, a lot of us lost our ability to take good care of ourselves. So I want to encourage the clients that I work with to see this as a chance to redo and clean up some of the bad habits that we caught ourselves in. All of our daily self-care routines are interrelated. If we're exercising better, we're going to sleep better. Usually if we're sleeping better, we eat better. If we eat better, then we want to exercise more, and we also need to have those regular breaks for leisure. Regular restorative sleep is essential, not only for our immune systems, but for our overall emotional health. And it's often a place where I do start in my work with clients so that we can be rested in order to take advantage of more advanced emotional regulation or cognitive strategies to get our lives back on track. But did you know that at least 1 in 3 adults report either having troubles falling asleep, staying asleep, or waking up tired? So it's really crucial that we take a look at this. I look at 3 levels of sleep intervention with my clients. There's sleep hygiene, there are supplements to consider, and there are sedative medications. Good sleep hygiene really means about going to bed around the same time every night, having a wind down routine so there's not high levels of sugars, alcohol, vigorous activities, caffeine before sleep, and of course trying to get off our devices, but having an actual book or an actual newspaper and having a wind down routine can really help. And the last part of sleep hygiene is about having a thought calming practice. Whether you have downloaded an app where you can listen to a sound or a voice of some kind, or whether you're just laying in bed, bringing attention to your breath by feeling your breath, counting your breath, that's the one I use, doing a visualizing of your breath, or just tuning into the mindfulness of your immediate environment of what you hear, feel, taste, smell, see, just to bring yourself into the present. Melatonin or magnesium or valerian root. And I will often refer clients to a naturopathic doctor to get a full assessment and to find out which supplement might be best for them. And lastly, there are sedative medications. When we've tried other routes and they haven't been productive, then often I refer clients back to their medical physicians in order to review the necessity or benefit of having a medication to help them get sleep. I like to discuss the idea of how to eat for our mental health. You may have read a blog on my website about We Eat How We Feel. There's also a blog on my website by a Toronto nutritionist by the name of Kyle Byron, who I really respect and will sometimes refer my clients to if we need added nutritional information. But what we know about mental health and food is that it is about having regular protein with green vegetables or low carb vegetables. It's not keto crazy, it's not Atkins, it's really about sustaining yourself with regular protein and reducing the glycemic roller coaster of having surges in energy and then crashing. That will just add on to any emotional reactions that we're having, especially for anxiety or depression. We want to limit caffeine, especially if you're battling anxiety. We want you eating consciously so that you can taste your food, that you can eat when you're hungry and not waiting till you're starving and restricting or over pushing yourself. And we don't want you stuffing yourself when you're already satisfied, or having the food replace an emotional need for you that would otherwise be dealt with in another way. Take care, and thanks for listening.